Michelle, thank you. A COVID-19 vaccine rollout could start as early as next week in the United Kingdom. The UK just became the first country to approve the Pfizer vaccine. It was authorized far quicker than any other in history. The first doses across the pond will go to healthcare workers, care home staff, and residents, as well as people over the age of 80. According to Johns Hopkins University, the UK has one of the highest COVID-19 deaths per capita rate on the entire planet. Back in this country, FDA regulators plan to discuss the Pfizer vaccine next week. Pfizer and Moderna, as you might know, submitted applications for an emergency use authorization. Many U.S. hospitals hope to have doses of the Pfizer vaccine before the end of 2020. North Carolina expects to get about 85,000 doses of Pfizer's coronavirus vaccine once it gets FDA approval. State leaders say healthcare workers would be some of the very first people in line to get that vaccine. Governor Roy Cooper says state leaders are working through logistical challenges right now of trying to get the vaccine to rural communities that don't have sufficient storage capacity. The governor says a COVID-19 vaccine will be free to anyone in our state who wants it, but it could be several more months before there's enough dosage for everyone, not just those in the highest risk groups. Novant Health is one of several places preparing to distribute the vaccine. Staff expects the first doses to arrive in the middle of this month. Novant purchased several low cold storage freezers in anticipation of the Pfizer vaccine. Moderna's can be stored in typical vaccine freezers. As hospitals wait for these dosages, doctors are reminding people not to let their guards down yet.
To get to market to protect us from COVID, we've all got to do our part to prevent the spread of the virus in the meantime, because if we don't, our hospital's going to get overwhelmed.
And North Carolina hospitals are already concerned about these current trends. The number of people in a hospital in our state with COVID-19 hit another new record again today, 2,039. Here's a look at the hospitalization running count since late October. The numbers, as you see, have been steadily climbing, and we have reached a number of record levels over the last few weeks. Other key metrics with regards to COVID-19 in our state are up as well. DHHS reported another 4,199 new cases today, third most of any single day since the pandemic started. That's up 1,300 since just yesterday. Our percentage of positive tests is also quite high right now, 11.4%. The state would prefer that number be closer to 5% or under. And these new numbers are concerning healthcare workers all across North Carolina. Cone Health's chief medical officer says people need to know what's being done right now to stop this virus from spreading, and he says now is the time to do it.
My plea is, I think as community members, we have a social contract with each other, and we have to treat each other well. And I've used the analogy before, if any of us saw somebody struggling on the street, couldn't get up, were really sick, we would do anything we could to help them. And, you know, all we have to do right now to help each other is wear a mask and keep distance from each other. It's such a simple thing to do, and we would do it in all sorts of other situations. Let's do it now.
We know what to do, so let's do it. Health experts agree following the 3 W's can prevent this virus from spreading. Remember to wear a mask, remember to wait 6 feet apart from people, and remember to wash your hands a lot. The governor's strict mask mandate requires people wear a mask anytime they're around someone who does not live in their home. It'll be at least another week before we see what impact Thanksgiving travel had on our coronavirus data. Health experts recommend people stay home, but they say, frankly, most people didn't listen. Now they're urging people to stay home for Christmas as well as New Year's. If people do not, experts recommend that folks get tested before and after they travel. They also recommend reducing your non-essential activities for at least a week after you've returned home. The CDC is shortening the time period that people should quarantine if they've potentially been exposed to COVID-19. Instead of staying home for 2 weeks, the guidelines now say you should quarantine for 7 to 10 days. It's a week if you get a negative test and 10 days if you do not get tested at all. The CDC director says this decision has been under review now for the last several weeks. And there's a live blog on our website, WXII12.com, with COVID-19 updates. You can find new information about the vaccine, the timeline, as well as the latest data straight from the State Department of Health and Human Services.